Hi everybody, welcome again to Dr. Manny's YouTube Learn Shops. This is qualitative research looking at data collection, and this is part 1. The learning objectives for this session are to discuss data collection challenges and issues that occur in qualitative research approaches. And we will just focus again on the 3 as an overview: grounded theory, phenomenology, and ethnography. Let's just recap a little bit of repetition. Qualitative research was really only employed by anthropologists and sociologists in about the early 1960s to the late 1970s. It was during the 1970s and 80s, however, that it was favoured by various other disciplines and academics in the branches of science and humanity, such as healthcare, psychology, nursing, management, political science, education, and communication studies. So qualitative research has been embraced by numerous additional disciplines. There are common research approaches. We've discussed some of them in previous sessions, and they being ethnography, phenomenology, grounded theory, but there are certainly other approaches as well, such as case studies, historical, and the narrative. Recapping again, in the ethnographic model, the goal is to learn and describe the culture's characteristics, much the same way anthropologists observe the cultural challenges and group motivations. Originally, culture was linked to the notion of ethnicity and its geographic location, but it includes virtually any group or organisation which I've mentioned in the past, which could be nursing in a hospital. The researcher becomes an active participant. They observe, they can interview, they can record on extensive field notes. In a healthcare model, it's central to understanding patients or healthcare professionals, such as us, being nurses. There's no preset time limit of what can be observed, and no real ending point in an ethnographic study if we choose to. Studies can go on for years. Then you've got the grounded theory method, where the objective is to develop a theory about the phenomena that you're interested in. It's a complex iterative process, as we've indicated previously, commencing with a generative question which guides the research. Initially, you can have open coding, which identifies themes, then it evolves into selective coding, and eventually concludes with one core category that's central to the whole process. You can use interviewing with open-ended questions, fieldwork, observation, focus groups, artifacts and historical text, or just documentation. There's no preset limit as to what the data can be collected, and again with no real ending point until you get data saturation. Then you have phenomenology as a method, and it's considered to be a philosophical perspective as well as a methodology. Disciplines, as in other methods that have embraced it, are psychology, sociology, nursing, and social work. The focus is on the subjective experiences and interpretations of the world, the lived experiences. Phenomenologists want to understand how the world appears to others. It describes. The goal is to describe how people feel about an experience or a specific event, a phenomenon. And again, it can utilize interviews, observation, surveys, etc. to gather information. When we look at research, and we focus on human experiences and human observations, we see that there are two very different operating systems that human beings have. One is a subconscious method of operation, which is fast and instinctual in relation to observations that are made when data is present. So at this present point in time, we're going to call it qualitative. The other operating system that's employed by human beings is slower. It's more orderly, systematic, and more methodical, wanting to evaluate all sources of data before deciding on the outcome. We'll call that quantitative. There are many forms of research that rely on the second operating system while ignoring the instinctual, intuitive nature of the human mind. In essence, preferring quantitative to qualitative. However, since we're focusing on qualitative research, we have to point out here that qualitative research doesn't ignore the subjective, the instinctual, the intuitive, the gut feeling. It embraces it, and the data that can be collected is often better for it. A deeper insight is provided. This is Albert Einstein, who's probably one of the most famous scientists globally. And he believed in the intuitive mind. This is one of his quotes. The intuitive mind is a sacred gift, and the rational mind is a faithful servant. So the intuitive mind is the qualitative. The rational mind is the quantitative. We have created a society that honours the servant, quantitative, and has forgotten the gift, the qualitative. There are certain challenges that are associated with qualitative research, which we have alluded to previously. However, it's all about perspective, what you see, what you believe, what you think truth is. It's all about perspective. And that's why it's important for you to understand the concept of ontology and epistemology. When we look at some of the challenges or the issues related to qualitative research, there are certain academics that believe that there are vague guidelines. Qualitative research doesn't promise a clear or a direct or an orderly or a systematic method of tackling research problems in health studies. It doesn't provide researchers with a set of rules to be followed or give them a comforting sense of security and safety backup against possible mistakes on the road to knowledge. A quote from Glasser and Strauss, who are grounded theorists. There are issues from research review committees, which I've certainly faced when wanting to do research studies. Because the problem is that for qualitative researchers, research committees are really primarily quantitative based. And if you want to get a research grant or a research proposal passed, they will be typically reviewing it on the principles of quantitative research methodologies. Because certainly here in Malaysia, and in other countries as well, quantitative research is the primary focus that research is based on. Therefore, for you, flexibility is actually the most important credibility criterion that's in all qualitative research, and it should be considered when a study is designed and a study process is being followed. But make no doubt, or have no doubt, quantitative studies are very different to qualitative studies. You have to understand the importance and the basis of a qualitative research study. Quantitative research is very structured, typically related to statistical analysis. There are objective conclusions, and they typically use surveys and experiments. Qualitative research is unstructured. It's subjective. It uses interviews, focus groups, and observations. As a qualitative researcher, you have to justify your choice. Why did you use qualitative research as a research design? And you've got to be specific, whether it's an ethnographic, phenomenological, or a grounded theory, or other approach. Academics that are non-qualitative say that there's a lack of researcher skills. For qualitative research, findings have to be trustworthy as well, and the researcher has to be specific, and they have to be skilled, and they have to have expertise with that specific research design and the topic being studied. So therefore you've got to be familiar with the data being collected. You've got to be familiar with the data being collected and analysing it, and you have to have knowledge regarding these issues to interpret the data. You've got to understand the philosophical underpinnings of your research design. So qualitative research is based on philosophical assumptions that you as a researcher have to understand. And we're talking about, again, the ontology, the epistemology, and they all focus on the methodology and the methods that you employ. Some researchers believe there's no need to study the methodology and methods before beginning the research. And many researchers do neglect to gain this knowledge because they're not aware of the qualitative inquiry complexities. So for example, ignorance about interview processes, qualitative sampling, data collection and analysis is common, which all affects the trustworthiness of your data and your actual study. Here's an interesting diagram. Look at the iceberg. The iceberg is typically seen above water, but the majority of it is underwater. So what we can see are the methodology and the methods which typically are employed, but what we don't see is your epistemology, your ontology. Ontology basically is, what do you as the researcher perceive as reality? The epistemology is what you as the researcher, what and how can you know what reality is, what knowledge is, what truth is. The methodology, what procedure can you as a researcher use to acquire that knowledge? The methods, what tools are you going to employ to acquire that knowledge? So answering the research question, you've got to be able to identify the research problem. And this is by forming the research question and selecting the appropriate research design. That's where you're going to have most of your problems. Formulating the research question in conjunction with the research problem, the problem statement, and then selecting the appropriate research design or approach to answer that question. Could be ethnographic, phenomenological, grounded theory, or other. There are others. So selecting an appropriate research methodology includes sample and setting, data collection and analysis, rigor, which quantitative researchers call validity and reliability, ethical considerations, and according to the research problem statement and question. So let's look at the research question. If we're forming the research question, it's supposed to provide important information on the research topic. So, first of all, it's going to be reviewed. Is the topic relevant? Is the topic that you've chosen researchable? Is the topic original? Because if they don't comply, what's the point of doing the research? The point of doing the research is to discover or validate previous information, or in qualitative research, it's to discover new, original, unique data. Furthermore, the research question in qualitative studies has an additional significance as it determines the manner in which you're going to do your study. The research question will guide you as to what methodology or approach to use. Looking at your design choice, this is the main concern that researchers have, but certainly new researchers, novice researchers, and deciding on whether it's the correct research design and methodology to answer your research question. Because if you choose the wrong one, it results in a lot of wasted time and effort. This is where crucial decisions need to be made about an appropriate approach, such as phenomenology, ethnography, or grounded theory, after deciding on your research question. The next question is the research credible? One of the key criteria is that of internal validity, quantitative terminology. Qualitative is credibility or trustworthiness of the data, in which you as the researcher seek to ensure that the study actually does what it's intended to do. A credible project employs a range of different research methods, which we've previously mentioned, called data triangulation. An iterative process, which is cyclic, and feedback to your participants, which includes debriefing. Then you've got to consider, are the research findings transferable? And this means the extent to which the findings of one study can be applied to other situations. As I indicated previously, I mean, if you're doing a study that's dealing with gerontology nurses, is it able to be transferred to other specialities in nursing, such as critical care, or oncology, or pediatrics, or perioperative nursing? Since the findings of a qualitative project are specific to a small number of a particular individual group or environment, it's difficult to demonstrate that the findings are applicable to other situations and populations, according to the academics. However, it's still important to consider that the findings of a qualitative study within a broader context of other people and settings. Because again, what you find could be transferable to physicians, pharmacists, other healthcare providers. Is the research process dependable? For qualitative research to be dependable, the processes within the study have to be reported in detail. That's why it's important that you know how to write. And if you know how to write, you're telling a story, thereby enabling a future researcher to repeat your work. If not necessarily gaining the same result, but repeating your work. And therefore, the research design may be viewed as a prototype model. This creates a model, and as such, other researchers can utilize it. Are the research findings reliable? Reliability basically means the extent to which qualitative findings can be confirmed, and that's challenging, as it's difficult ensuring objectivity according to the quantitative academics. However, it's important to ensure methodological rigor, quality of your research, and if the credibility, transferability, dependability, and confirmability, which are aspects related to reliability and validity, these are aspects of research that are taken into account. And if they are, then qualitative research should be seen as reliable, which means you can trust the findings of the researcher. What are some of the qualitative research issues? Well, some of the issues are that you've got certain scientists or academics that follow the positivist or scientific or quantitative methodologies. So you have scientific skepticism related to qualitative research. And the scientific healthcare community still look at qualitative research with a lot of cynicism, especially physicians. Also alleging that qualitative research isn't scientific because it doesn't have facts and it's subjective in nature. There's an issue related to acceptance. Qualitative research isn't always accepted, and as I indicated, and have indicated many times, because of the subjective nature of the data, the findings are not always accepted by the scientific community. Although there are a lot more scientists now that are utilising qualitative research, or certainly as a mixed methodology. And often, in order for qualitative research findings to be accepted, a second independent qualitative research study is often necessary to begin the process of acceptance. When it comes to qualitative research, another issue that it's time consuming. Qualitative studies are labour intensive, as we've indicated previously. Whether it's grounded theory, phenomenology or ethnography or others. So for example, if you were doing interviews that were conducted with 15 nurses in 5 different hospitals, then data collection will be time consuming due to 1, distance issues, appointment dates and times which are acceptable to the study participants, and possibly where the study is taking place in a hospital. You've got time-consuming analysis. Applying analysis to qualitative or numerical data, the research process can be long and tedious because the researcher, you as a qualitative researcher, have to carefully analyse the data in detail while writing the report. An example that I alluded to previously in grounded theory, you've got to identify themes which generate codes, which generate categories and subcategories, and eventually a core category. These all have to be identified, and they all have to be logged. Then you've got the issue of limited sample size. And sample size still seems to be a big issue with quantitative researchers and qualitative researchers even. For example, you can have 200 employees based upon a sample of 5 employees. And this will raise the question with some academics of whether sampling will provide a true reflection of the views of the remaining 97.5% of the company or the population. Then you've got replication with sample size. As we've indicated numerous times, small sample sizes can be an advantage, but they can also be a disadvantage. A small sample isn't always representative of a larger population, even if there are similarities with the individuals involved. This means a follow-up with a larger quantitative sample may be necessary, according to some academics. However, replication isn't something that is typically required in qualitative research. Transferability isn't something that is required in qualitative research. Generalizability isn't something that is required in qualitative research. However, to change people's minds, the scientific community, in relation to qualitative research, it's a different methodology compared to quantitative research. Study replication, the reality is that qualitative research is challenging for other researchers to replicate. And this makes it hard to confirm or deny the results of the original study, according to some academics. So for example, in education, one of the challenges of replicating a qualitative study that's different, has different elements from the original study, can't be repeated. So for example, the teachers and students will be different if you want to do the study 5 years down the track. The school and the classroom environment will be different if you want to do the research 2 years down the track. The methods of teaching and styles of learning are different with every single teacher. So you may not get the same findings that were found in the original study. Another issue is that it's not statistically representative. One disadvantage, according to some of the academics, is that qualitative research lacks statistical representation. It's a perspective-based method of research only, which means that the responses aren't measured. Quantitative data is required for circumstances which need statistical representation, and that's not part of the qualitative research process. So there are no statistics in qualitative research. If you're doing quantitative or a mixed method approach, then there will be. Then you've got issues that deal with sampling bias. In statistics, quantitative research, sampling bias is a prejudice in which the sample is collected in such a way that some of the members of the intended population are less likely to be included than others. In other words, the qualitative sample will never include a representative overview of all the people in the study. It's not meant to. That's not the purpose of the qualitative research. Then you've got bias related to the researcher. The quality of the data that's collected through qualitative research is highly dependent on you as the researcher and your skills. If a researcher has a biased point of view, then their perspective will influence the findings. And according to certain academics, controls have to be in place to remove the potential for bias, so data is collected and has integrity. However, we spoke about the concept of bracketing in qualitative research previously. There are certain qualitative academics who believe that you can't eliminate bias, whether it's quantitative or qualitative or mixed methodology. How can you be neutral as a researcher? Then you've got what is called observation bias, and this introduces the concept of the Hawthorne effect. And participants in a behavioural study may change their behaviour or performance in response to being observed. And from academics' perspective, this also can affect quantitative research. I mean, if the observed or the participants know they're being observed, they may perform differently. Quantitatively, qualitatively, mixed methodology. If someone, for example, is observing you doing hand hygiene in a hand hygiene study, you may wash your hands a lot more. In comparison to if you're not being observed, you may wash them less. So, bias is relevant in all aspects. Then when it comes to qualitative research, there's a perceived lack of rigour. Quantitative research can demonstrate validity and reliability, which we call rigour or quality in qualitative research, by including a wide variety of numerical and statistical data. Rigour, however, of qualitative research is harder to demonstrate because it often involves the analysis of qualitative data. So for example, qualitative researchers, counteract perceived lack of rigour with criteria which qualitative research can be judged against, such as trustworthiness, credibility, quality, uniqueness, transparency, dependability, confirmability. The list goes on and on and on and on, because there are certain academics in qualitative research that have their own way of validating rigour. Then you've got ethical challenges. Qualitative researchers face ethical challenges in all stages of their research study, from the beginning designing to the end reporting. And these can include anonymity, confidentiality, informed consent, the relationship that the researcher and participant have, the potential impact of the study. Ethical issues in general, data collection activities that require more than casual interaction with a person require individual, informed consent from the participant in that study. And this involves things like in-depth interviews and focus groups, and even documentation that the participant may provide. So, the person must be told the purpose of the research, what the expected outcome is, what the expectations of the research participant are, the risks and benefits, which include physical, psychological, and a social impact. They are informed that participation is voluntary and they can withdraw at any point in time without there being any penalties. They're told how their confidentiality will be protected and how you will secure and protect the data which only the researcher and possibly their supervisor may see. They're given contact information of the lead investigator, the researcher, in case there are any issues which they would like addressed or explained. So in conclusion, qualitative research focuses on the social world, as we've said previously, and provides researchers with the tools to study phenomena from the perspective of those experiencing them. Identifying the research problem, forming the research question, selecting the appropriate research methodology and design are some of the initial challenges and issues that qualitative researchers encounter in the early stages of their research project. And remember, there are always going to be academics that challenge qualitative researchers. And that's certainly valid and relevant in Malaysia. Okay, thanks everybody. As previously, if you found this session worthwhile, check out some of the other Dr. Manny Learn shops on YouTube. Okay, bye for now.